Pre-treatment is important for a trouble-free examination. In particular, it's essential to eliminate nasal pain during scope insertion and examination. Antispasmodic agents such as anticholinergic agents and sedatives are not used regularly as pre-medication. 15 minutes before the start of the examination, the patient is instructed to take tepid water containing dimethyl-polysiloxane, Pronase, and sodium bicarbonate as pre-treatment. On average, 3 times counterclockwise, so that the drug solution distributes throughout the gastric wall. Ten minutes before the start of the examination, the vasoconstrictor, naphthalene nitrate, is sprayed into the nasal cavities a few times, and the patient is instructed to indicate the nasal cavity that has better passage. This contracts the nasal concha, widens the nasal cavity, and facilitates the passage of an endoscope while preventing epistaxis. The treatment delays absorption of the local anesthetic agent into the bloodstream, resulting in prolonged anesthesia and prophylaxis of local anesthetic intoxication. 5 minutes before the start of the examination, 2% lidocaine hydrochloride viscous is slowly instilled into the nasal cavity that has better passage. The patient is instructed to swallow the agent when it reaches the pharynx. These procedures produce an adequate level of pharyngeal anesthesia. After instillation of 2% lidocaine hydrochloride viscous, a 14 French catheter with a length of 12 centimeters is inserted approximately 10 centimeters into the nasal cavity. Before insertion, the stick is lubricated with a small amount of 2% lidocaine hydrochloride jelly, followed by a few puffs of 8% lidocaine hydrochloride spray. Special attention to the angle at which the catheter is inserted is critical. Insertion nearly perpendicular to the face advances the catheter to the inferior meatus, and insertion at an upward angle of approximately 5 degrees advances the stick to the middle medius. Insertion at an upward angle greater than 5 degrees advances the catheter to the superior meatus and causes pain. For pre-treatment, 8% lidocaine hydrochloride is used. Direct intranasal spray of 4% lidocaine hydrochloride may result in aspiration into the trachea and local anesthetic intoxication. Larger doses are required to deliver the anesthetic throughout the nasal mucosa by direct spray. When 8% lidocaine is sprayed on the catheter, however, the anesthetic only affects the mucosal membrane on which the scope passes. Spraying the surface of the catheter requires the use of less anesthetic. Moreover, this procedure allows the alcohol in the drug solution to evaporate during spraying and thus causes no irritation to the patient. Thus, application of 8% lidocaine hydrochloride spray on the catheter produces safe intranasal anesthesia. 1 minute later, this catheter is removed, and a similarly treated 16 French catheter is inserted. Again, the catheter is inserted perpendicular to the face. This catheter has the same diameter as a scope used for actual examination. Now pre-treatment is completed. To prevent the catheter from entering the nasal cavity, instruct the patient not to touch the catheter and then guide the patient to the examination room.